Hello, I'm Molly, and today I will be taking you through transcranial direct current stimulation, what it is, and how it can be used for treatment in major depressive disorder. So, what is transcranial direct current stimulation? Throughout this presentation, I will be referring to it as TDCS. So, TDCS is a non invasive technique that may be used to help various neurological and psychiatric disorders. Current research has provided evidence to support the use of TDCS in a clinical setting. So, how does it work? TDCS is conducted by a constant electric current produced by a battery operated current generator and is connected to at least two electrodes. It is applied to specific head locations depending on what is being treated. The electricity is sent to the brain regions and works to alter neural resting membrane potentials, increasing the likelihood of depolarization or hyperpolarization without inducing action potential, meaning it could stimulate neural activity in underlying parts of the brain. Research in major depressive disorder suggests that it is caused by pathological alterations in the limbic system and the cortical structures, lowered activity in the dorsal and ventromedial areas of the prefrontal cortex, the amygdala, and the hippocampus. Research also indicated there was a lower activity in the left hemisphere and higher activity in the right cortex. So, how can TDCS be used as a treatment for depressive disorders? Well, studies have suggested that by modifying the left dorsal prefrontal cortex, there will be improvement in executive functioning of the working memory, along with enhancements of identification of positive visual material. So, why use transcranial direct current stimulation for major depressive disorder? So, in a report conducted by Pryor and others, they investigated how TDCS may be used for those who did not see an improvement in their major depressive disorder when undergoing pharmacological treatment. So, they basically were being resistant to antidepressant drugs. The initial research indicated that because TDCS is a simple non invasive technique for the brain, it may be able to induce functioning changes to the cerebral cortex and may be affected in the treatment of major depressive disorder, as TDCS can balance the hyperactivity seen in the left dorsal prefrontal cortex, which is seen in major depressive disorder. As we see here on the left-hand side, the neurotypical brain, and on the right-hand side, the brain of someone who is diagnosed with major depressive disorder. While researching, the limitations have stood out that TDCS itself does not have a large field of research being done on it. And although most articles express that this technology may be used to aid psychological barriers that people face day to day, therefore helping people who haven't been able to access it before when they didn't respond to drug treatment, but it is not out there currently. So it may be beneficial for there to be larger trials done on participants who have a larger range of severity of major depressive disorder. This would also be good to get a greater knowledge on what this technology is and what it can do for people with the disorder. In the future, this research may be used to prevent the effects that major depressive disorder has on quality of life. Once more research has been done on it, a long term solution may be found so that patients do not need to do TDCS as often and have longer lasting effects. More trials should be conducted on a wider range of age groups and changes on how the equipment is used as we find more new findings so it can be updated. Finally, making it more accessible. So research has found that TDCS can help assist many people who suffer from major depressive disorder. However, it's not accessible to them. That concludes my presentation, and here is a list of references used throughout my research.